Thank you. I'll talk fast. My name is Heather Bollinger, and I've been a night shift nurse at the ED for 7 years.
You want to raise the microphone a little higher?
Certainly.
So that we can all hear you. Thank you.
I'd like to outline a recent shift in our department that exemplifies our staffing concerns. On my last shift in charge of the trauma area, my nurses had the following assignments. Rob Alvarez had 3 patients, including 1 ICU patient, 1 altered restrained 5150 patient. Neil Ford's assignment consisted of 2 ICU patients and an active cardiac arrest. Audrey Smith was caring for 4 patients, one of whom had a dislocated shoulder and was in acute pain, and Michael Cassin's 4-patient load included 2 ICU patients and 1 agitated, restrained, and screaming patient, also on a 51 hold. Our acuity nurse was off the unit transporting patients to and from CT, and my own patient load consisted of 3 patients. So at this point, 3 of my 4 nurses are already over their Title 22 ratio, and the remaining 2 RNs are at capacity. With these patient loads already in place, 4 stab wounds arrived, all at once. I have 4 RNs, and they're already well over a reasonable patient load. I'd like you to consider how much care those ICU patients were getting while all hands were on deck for the recently arrived traumas. About 2 hours into this chaos, after 2 of the ICU patients left the department, one of the stab wounds went to the OR, and the screaming 5150 patient was medicated. The dislocated shoulder was still waiting for treatment. A nice young man who'd been in a motorcycle accident stopped me and said, "I'm really sorry to ask this, but is there any way I can go to the bathroom?" That's just sad. Sadder still is my only option is to hand him a urinal, hold a blanket up in front of his bed in the hallway to try to protect his privacy. My rooms are full. ICU patients, trauma patients are everywhere. We've done everything we can, and we have insufficient resources. And this poor man has been waiting how long? He doesn't even want to ask if he can go pee. About an hour later, a young man who was sitting at his girlfriend's bedside stood up and punched a hole in the wall. He was angry. His girlfriend had been waiting 4 hours for a CT scan. They didn't know if there were any broken bones in her face after an assault. Shortly after he was arrested, in the Zone 1 hallway, we got the ring down that 2 gunshot wound victims were on their way. This is our reality. Not every night, but most nights. This is the trauma center. Anytime and any day, you could be the man waiting, lying in the hallway, afraid to ask if you could pee. Your wife could be in the bed next to the young man who punches a hole in the wall. Your child could be laying next to the agitated 5150 patient whose nurse is accommodating a trauma patient. This reality is we do have staffing issues, and they do affect patient safety. And we're asking for your help to try to resolve those. Thank you for your time.
Thank you.